A new $1.5 million project will bring a pharmacy to Trinity Health Clinica Santa Maria on Grand Rapids' southwest side. Good morning, ladies and gentlemen. I'm News 8 digital anchor Luke Lasser here from the Wood TV Live Desk. Joining me this morning is Cameron Selleck, a practice leader at Trinity Health Clinica Santa Maria there. Cameron, good morning to you.
Good morning, Luke.
Appreciate you taking the time. Before we get rolling here, if you could just share a little bit on your role there with Trinity Health.
Yeah, so like you said, Luke, I'm the practice leader at Trinity Health Medical Group Clinica Santa Maria. So my role on a day-to-day basis is serve as a leader here in the office with our primary care providers, along with the staff and all of the services we provide here at Clinica.
So big project there, $1.5 million. Tell me about this new pharmacy.
Yeah, so it's a really exciting day. Today is actually the first construction day for the pharmacy project. We're adding a 2,000 square foot pharmacy to Clinica Santa Maria. The timeline is looking starting today, hopefully wrapping up around December for the construction piece of it. It'll be a fully staffed pharmacy providing pharmaceutical over-the-counter services, education services through the pharmacist, and also a drive-through service as well.
I'll give you a broad question here that could open up for a broad answer, but why? Why build this pharmacy?
Well, you know, Clinica Santa Maria is on the southwest side of Grand Rapids, and we serve primarily a Hispanic Latino community. And a lot of our patients do encounter a lot of social barriers in their lives. And we like to think of Clinica is a one-stop shop. We want to provide as many services as we can to our patients to help with those barriers. If we can't remove them, we want to at least help as much as we can. So this is just another way that we're going to be able to serve patients, not only for Clinica Santa Maria, but the community in general. You know, this is going to open up pharmacy services to this whole area. So it's going to be very convenient. There's really not a pharmacy in close proximity to our office. So again, just that one-stop shop, have your health care here, pick up your prescription medications here. So I think it's going to be great for the patients and the healthcare providers working here.
You mentioned it being fully staffed. That opens the door to a handful of new jobs. Tell me about some of those positions and the application process there. If that's open now, if that'll be open once the project is complete.
Yep. So I believe the pharmacy will be staffed by four new colleagues. That'll be pharmacists, pharmacy techs. The application process, I don't have a lot of great detail on that for you right now, but if anybody has questions, they're more than welcome to reach out to the clinic and we can point them in the right direction. Or also all of our applications through Trinity Health are on our website as well.
It's mentioned that employees at this location are bilingual. Will those requirements be the same for these positions as well?
Yeah, that's the plan, Luke, is, language obviously is a big barrier for a lot of people living in this community. So Clinica Santa Maria is staffed by about 50 staff members as our broader team. And almost all of us here are bilingual, English, Spanish, and the plan would be to do the same with the pharmacy.
At that location right now, this is kind of a question in terms of traffic or warnings in that area. Is there anything that people going there right now should be cautious about in terms of where the construction is?
Yeah, so the pharmacy, the addition is going to be added right into our current patient parking lot. The finished product will take up about half of that area, and then there'll be some green space with some handicap parking accessibility when the project is done. So that the entryway off of Cesar Chavez, which most patients are probably familiar with entering the parking lot, is it's a shared driveway with the Habitat housing right next door, and will remain open for them and for the construction crew that's bringing in equipment. But we're really hoping to have patients enter into our parking lot off of Martin Luther King Jr., which is located just behind our building, because the main parking lot will be shut down for construction. And then moving forward, our parking will be, I call it our lower lot, but it's behind Clinica Santa Maria and behind the dwelling place apartments as well. There's a large parking lot with plenty of space for our patients. And, like I said, the project is probably about 6 to 7 months long. I just really, encourage people to be patient with the process, drive slow in the area, watch for patients walking through, and it'll be well worth the wait.
Cameron, in your view, why is having something like this in that community important?
Well, I think the convenience is going to be really nice for the patients. We send out prescriptions on a daily basis, hourly basis for our patients. And there's no pharmacy in direct, proximity to us, which can make it challenging for patients, for transportation, and also for language. At Clinica, we don't think of, we don't really have a language barrier because we have a bilingual staff. And, Luke, as you probably know, the healthcare system is pretty complex. It can be tough to navigate. And this gives, hopefully will eliminate a couple barriers there. The other piece of this is for our healthcare team here, our providers and nurses, our behavioral health specialists, is this provides an addition to our team and provides an open lane of communication to really improve patient care.
Cameron, anything else that you would like to add? If not, no big deal, but always like to ask.
Yeah, I mean, we're really excited for this project. I mean, this is, there's been conversations ongoing now. I think this project was announced almost 5 years ago. So it's here. Construction started this morning. I just really encourage the community to be as excited as we are. There's, we got a little time before it's done. But if people have any questions or concerns, feel free to reach out to the office and we can help out with those.
Ladies and gentlemen, if you tuned in maybe halfway through the stream or just now clicking in, there's a link attached. If you're viewing here on Facebook, it's attached to it. It takes you over to woodtv.com. You're able to view our full conversation there. Cameron, thank you.
Luke, thanks for having me.
Ladies and gentlemen, this has been a look at the Wood TV Live Desk. I'm News 8 digital anchor Luke Laster. Have a great morning and a great afternoon. We'll see you around, folks.